Hi guys, my name is Kelly and I'm going to be doing my venipuncture. So I was looking over my patient, Miss Wanda Chi. I was looking over her chart and I saw that the doctor has ordered an HIV viral load and a CBC for her this morning at 8 o'clock. And so I'm gonna go in, I've gathered my supplies and I'm gonna go into Miss Wanda Chi's room. Okay, so hi, Miss Wanda. My name is Kelly. I'm going to be your nurse today. I'm here to draw some blood. Unfortunately, I know, I'm so sorry. Miss Wanda, could you just really quickly just verify your name and your date of birth for me? Miss Wanda Chi, 9/20/19XX. Thank you so much, Miss Chi. And do you have any allergies? No allergies. Okay, thank you. So, unfortunately, the doctor has ordered me to come in here and get some blood from you, okay? Okay, that's fine. I'm sorry. All right, so I have performed hand hygiene and I have donned clean gloves and I'm ready to do my skill. So I have my supplies here. I have my tourniquet. I have my 2 tubes that I need, my gauze, my alcohol pad, my biohazard bag, and my needle with my Vacutainer and Miss Wanda Chi. So these are my orders and I've just pulled them up in the room. I want to make sure that I am only drawing 2 tubes and I'm not missing anything. So okay, Miss Wanda, as I'm talking to her and saying my good mornings and assessing her, I'm looking at her skin and making sure that I can draw somewhere appropriate and she doesn't have any dialysis shunts I need to worry about, or she hasn't had a mastectomy in the past that I need to worry about. So I've decided to go with her right arm here. Okay, Miss Chi, so is it okay if I use this right arm? Yes, it's fine. Okay. I'm sorry again. I know this is not fun, okay? And I'm going to try to be as gentle as I can and as quick as I can, okay? Okay. So I need to make sure that, oh, her arm. Miss Wanda, keep your arm still. No, just playing. Sorry, guys. Bear with me. I'm making sure that I'm applying my tourniquet at least 3 to 4 inches above the site I want to go in. And I want to make sure that I didn't tie it too tight, so I'm going to check her distal. I'm going to check her pulse and make sure that I can still feel it and that it's not on too tight. And I'm going to work quickly because I can only leave this on for about a minute, okay? So, okay, Miss Wanda, I need you to make a fist for me, okay? So that your veins can pop up for me. And so I'm just assessing it and I feel one and I see it, but I still want to make sure that it's a good vein before I poke it because they could be tricky. So I'm going to go ahead and clean my site and I want to go from an inward to an outward motion, and it's clean. And so as I wait for that to dry, I'm going to get my Vacutainer and make sure that everything is in good working and it's not expired. And so, all right, Miss Chi, you can relax your hand now. I'm going to poke now, okay? I'm going to make sure that I pull her skin back just to smooth it out for me. Just to smooth it out for me. And I'm going to let her know that I'm ready to poke, okay? So 1, 2, 3, small poke, and it's in, and I'm getting blood return. I heard the pop, and it's good. And I want to make sure that I start with my red top. Okay, Miss Chi, this is your red top. This is a red top. This is for your HIV, okay? We want to just monitor the status of it, and we want to make sure that those antiretrovirals you're taking are working for you. And I'm going to shake that. And I'm going to do my CBC, this purple top. And this is your CBC, Miss Chi. This is your complete blood count. And we just want to make sure that we have enough blood in there in your system, okay? And that's good. And I'm going to shake that, take off the tourniquet, release the tourniquet. And I'm going to get my gauze. All right, I'm taking it out, 1, 2, 3. And as soon as it comes out, I want to apply pressure. I'm going to lock my needle here and put it aside so that I can throw it into the sharp spin. All right, and I'm going to want to apply pressure for about 30 seconds to a few minutes, just depending on how bad Miss Chi's bleeding. That wasn't so bad, right, Miss Chi? No, it wasn't. And she's not bleeding anymore, so I'm gonna apply my tape. And I'm gonna want to then label my tubes. So I'm gonna ask Miss Chi. Miss Chi, just one more time, could you please verify your name and your date of birth? And my label is correct. This is Miss Chi's label, and I'm gonna make sure I initial, dated, and timed it. Thank you so much, Miss Chi, for being for cooperating with me, okay? And she's so sweet. And I've put these in my biohazard bag, and they're ready to go. Okay, Miss Chi, so that was it. Is there anything else I can do for you? And she says no. Are you comfortable? She's very comfortable. I have put her bed in the lowest position. I've put her rails up and have provided her call light, and just in case she needs to get a hold of me. And I've let her know that these labs may take about 30 to an hour, so she may not see me until then, but I'll be right back as soon as I get those resulted. And I will also let her doctor know as soon as the results come back, especially if they're critical values as ordered. And I have removed my gloves and performed and washed my hands. And one more time, I'm gonna ask Miss Chi if there's anything I can do for her before I leave. She says no, she's fine. I say thank you one more time. And when I leave, I want to document that the patient tolerated well, and that I got my HIV viral load and my CBC from the right AC, and I'm gonna send them off to lab and wait for them to get resulted, and notify my physician if there's any critical values that he needs to know of. And that's it, guys. Thank you.